Hi Blake, my name is Lindsay Kaiser. I'm the PA who will be taking care of you today. I'm gonna wash my hands first over here. So I'm gonna go ahead and do my general survey first. I'm gonna assess the patient's ability to cooperate, affect, level of consciousness and distress. I'm gonna go ahead and assess nutritional state, posture, and speech. I'm gonna move on to vital signs now. So I'm gonna assess height, weight, and temperature. This has already been done. I'm going to assess respiratory rate, rhythm, and depth of respirations. I'm going to go ahead and palpate the radial pulse for rate, rhythm, and amplitude. I am now going to have someone get me a blood pressure cuff and palpate the systolic blood pressure in the left arm while seated position. During your checkout, you will not be required to actually do it. You just need to demonstrate. Actually, take that off for me. I'm now going to palpate or auscultate blood pressure in the left arm sitting. Heart level. I'm actually going to have you hold my thermometer. I will now auscultate blood pressure in the left arm standing. Go ahead and stand for me. I'll now move on to the skin exam. And so I'm going to now go ahead and have it seat. Inspect and palpate for color, moisture, temperature, turgor, and any lesions. I'm now going to inspect and palpate that I would then, if I found a lesion, I would inspect and palpate for location, number, size, shape, color, and any elevation. Go ahead and find a lesion, and pretend like you are doing all of those things. I'm now going to inspect and palpate hair for distribution, quantity, texture, and areas of any hair loss. I will now inspect the finger and toenails for color, thickness, and surface conditions. I'll have you will normally be in a gown, and so
when you test off, you will be inspecting, taking shoes and socks off, and inspecting those.
Okay. I will now inspect nail base angle for clubbing. You go ahead and hold your nails up like this. Okay, and I'll also look at your thumbs. Again, looking for the clubbing there, if there's any hypertrophy. I'm now going to perform the capillary refill test bilaterally of both upper and lower extremities. And so I want you to take that and you'll just push there, noting should be less than 1 to 2 seconds for refill. I will now move on to the neck. I'm going to inspect Oh, thank you. Sorry. I'm going to move on to the head. Oh, moved. Inspect and palpate for size, shape, symmetry, and tenderness. And so again, I'll just kind of do this. I'm going to inspect facial features for symmetry and parotid gland enlargement. I'm going to palpate the TM joints for pain, swelling, while patient opens and closes jaw. Go ahead and open and close your jaw for me. Thank you. I'm going to palpate the temporal arteries for tenderness and thickness. Again, using the pads of your fingers, don't push too hard, you'll tampen on that temporal artery down. And then this side. Doesn't really matter which hand you use, I like to use my dominant hand though. And finally, I'm going to auscultate the temporal arteries for bruits using my bell. Moving on to the neck, I'm going to inspect Symmetry and thyroid for enlargement. Go ahead and swallow for me. Okay. I'm going to palpate the trachea for midline position using both of my thumbs. Palpate for position. I'm now going to palpate lymph nodes for size, consistency, tenderness, and mobility, going in the following order: occipital, posterior auricular, anterior, posterior and anterior, superficial and deep, cervical, preauricular, submandibular, submental, superficial, and post-supraclavicular. Make sure you're getting all the way here. I'm now going to palpate the thyroid gland for size, consistency, tenderness, and nodules using a posterior approach.
Let's see if you want to put them on a stool in front.
I can do that later. I'm always tipping the head to the side that I'm examining, so I'll tip the patient's head to the right and slightly forward to isolate, get the sternocleidomastoid out of the way. I'm then going to push the trachea. Again, that rolling motion. Now to the left, slightly forward and tipped. I'm pushing the trachea now to the left. The rolling motion. Go ahead and swallow. And then I'll go back to the right and have you swallow again. Again, examine the side to the side you tip. I'm now going to palpate the carotid arteries bilaterally for rate, rhythm, contour, and amplitude. And finally, I'm going to auscultate carotid arteries with the bell for bruits, having the patient hold their breath. Go ahead and hold your breath. Go ahead and breathe. Go ahead and hold your breath for me.